You're tuned in to Inside Lowell. Inside Lowell podcast brought to you in part by Washington Savings Bank, serving the greater Lowell community for over 130 years. Make the switch now to Washington Savings Bank. UniCare, offering a variety of plans for people insured under the GIC. At UniCare, your health is their top priority. Reverie 73, Lowell's #1 cannabis shop. Elevate your cannabis experience at Reverie 73. Hafner's, heating and cooling homes and businesses for nearly a century. Become a part of the Hafner's family. It kicks. Boston North Company, offering a wide variety of business solutions to help restaurant and retail clients save money. Boston North. And by Mahoney Oil Company, providing warmth and protection to families in Greater Lowell and Southern New Hampshire since 1925. That's Mahoney Oil. And now, time for another Inside Lowell podcast. Inside Lowell. If Lowell is your home, this is your place.
Hello once again, everyone, and welcome to another Inside Lowell podcast. I am your host, Teddy Panos, coming to you from the Inside Lowell studios here in beautiful, historic downtown Lowell. Very excited this morning. We're recording this on Monday morning, October 16th, for those of you who are watching it on a different date and time. But excited to kick off a brand new segment here called Health Minute with Dr. Carolyn Langer, brought to you by our friends at UniCare. You heard all about them, or a little bit about them, I should say, during our show intro there, where we thank all our sponsors. You're going to hear a lot more about them with some other special features that we have coming up surrounding education. But this one is one that I'm very excited to be doing, because talking about health and whole health and wellness, such an important part of our communities and our societies now, and nobody does it better than UniCare, and very few people are more qualified to talk about it than my special guest who's joining me here in the studios for this podcast, Dr. Carolyn Langer from UniCare. Thank you so much for being here, Dr. Langer.
Thank you, Teddy, for having me. Great to be here.
Yeah, it's a pleasure, and I'm just kind of going to take a minute. Since this is the introductory podcast with you, you're going to join us every month to focus on a different component of health. But I just want to kind of let people know a little bit about your background so that they understand that when you talk about this, you have lived it and you know it very well. But you are the medical director, as we said, for UniCare, which you've been doing for how long now?
So I've been at the company for 2 years now.
2 years, okay. Your path there is interesting. You have an extensive career as a physician executive. You've held leadership positions at several different health plans, as well as being serving as the chief medical officer at Mass Health. You're an associate professor at the UMass Chan Medical School and an instructor at Harvard's T.H. Chan School of Public Health. So you also impart your wisdom and experience on future medical professionals. You sit on the advisory board of the Health Law, Policy, and Management Department at the Boston University School of Public Health. You received your medical degree from Jefferson Medical College and completed your residency at the HSPH, which is basically the Harvard Medical School, right? And
Harvard School of Public Health.
Harvard School of Public Health, and you are board certified in occupational medicine. Now, this is where your background gets fun. You also hold a law degree and a master's in public health from Harvard. The law degree, when did you find time to go get a law degree?
I think I did all that before I got married and had kids, but no, it's great background to have, especially with the work I do, and just always had an interest in the intersection of law and medicine, health law, medical ethics. Mm-hmm.
And so the part of your background, I saved this for the end because this is the part that interests me the most. You're a retired colonel and former flight surgeon in the Army National Guard. What was that experience like for you?
That was just such a terrific experience. One of the best experiences in my career, and just so great to have served in the military and worked with many other professionals who are just so mission oriented.
So all of that, you really sounds like you could have written your own ticket to wherever you wanted your career to take you, and you've ended up with UniCare. Why? How did you get there, and why did you choose this path?
It's really important for me to stay locally and to see the impact of my work locally. So I really wanted to stay connected to Massachusetts.
And well, you certainly have with UniCare, because they are quite connected to our communities out there. What exactly does a medical director at a health plan do?
Yeah, so I seek to advance the whole person integrated health of our members. I do this by leading clinical strategy, providing clinical leadership around gaps in care, helping our members to get the preventive services they need, and really providing them with the resources they need to stay healthy.
So you're located in Woburn, but your reach goes throughout the entire Commonwealth of Massachusetts, and actually the entire country for that matter, right?
That's right. So we ensure we provide health benefits to state employees, retirees, and municipal workers who are insured by the Group Insurance Commission.
And that is basically any government or state government employee, or even municipal employees as well. Yeah. So I know here in Lowell, a lot of our teachers and educators, but also our police officers and firefighters are covered and benefit from kind of the services you help provide, right?
That's right. That's right.
Now, when you at UniCare, this is very prominent on their website. When I first started looking up the company, it talks an awful lot about the whole health of your members is the #1 priority. What does whole health mean?
Yeah, so to us, whole health is more than just physical health. It also includes mental health, emotional health, social well-being. And so we really try to address the whole person.
I think maybe recently there's been a little bit more awareness of it, but for the longest time, people were ignorant about how mental health and social well-being impact your physical health. And, a little focus on that, a little preventative medicine, dare I say, goes a long way into keeping you healthier from all the other physical ailments that could hit, right?
That's right. People with chronic medical conditions often have many significant behavioral health issues that exacerbate their chronic conditions. So we really try to form an interdisciplinary team. I have on my team, besides medical directors, nurses, case managers, social workers, health coaches, all really trying to address the whole health of our members.
Now, what you do, you're not actually providing the health care to the individuals. Instead, you're kind of providing the guidance and creating the different options that you recommend. Is that accurate?
That's right. So we're not a direct provider, but we provide health benefits. We also provide care management services. We really try to help our members navigate the healthcare system and to address any gaps in care, really trying to work with not just our high-risk members, but also any individuals who might need preventive services, really trying to identify where they might have gaps.
And you, not just your members, but also the families of those members, if they choose a family plan. So that means you're kind of covering everything from the gamut of the municipal or state employee right on down to their brand new newborns and kids going through school and whatnot, right?
Yes, that's right. Our membership includes not only the employees and retirees, but many times their family members.
All right. So that kind of establishes who you are and what you do. And here on Health Minute with Dr. Langer, brought to you by UniCare, we're going to be talking each month. We're going to focus on a different aspect, different component of health. And since today, as we said, is October 16th that we're recording this, you wanted to kind of get the message out about the flu. Flu season is nearly upon us. Flu vaccine season has already started, though, right?
It has. So generally speaking, I recommend that individuals get their flu shot in September, October, before we really start seeing cases of flu here in Massachusetts.
When do we start to see flu cases? Because there's a bunch of people all around me who are sick right now, and they're doing the COVID testing, and some are getting the nose. So they just say, well, it must just be the flu, or something viral is the term used. Yeah. When did this flu season start? When does it end? And when is the most critical time?
Yeah, so we generally see, it can vary from year to year, but generally we start seeing cases in November, December, and often see it peak between December and February, although there are years when we can see flu cases all the way out to May. So that's why it's really important to get your flu shot in the beginning of the season.
Wow, up till May. Didn't realize it could go that long.
There are years when that does happen, but again, the peak is generally between December and February. So we really recommend that people get in their shot in the fall.
Okay, so why then, if the peak is December, January, February, why is it important to get the shot now?
So it does take up to 2 weeks to develop full immunity. So if you get your shot now, you'll be protected by the time we really see cases peak.
Mm-hmm. What are the symptoms of the flu?
Yeah, so the symptoms are fever, headaches, muscle aches, fatigue. But without the flu shot, your symptoms can really be pretty severe in some cases, particularly for certain vulnerable populations. So babies, young children, pregnant women, older adults, people with chronic conditions such as asthma, diabetes, heart disease, lung disease. It's particularly important for these vulnerable populations to get their flu vaccine, but it's important for everybody in the community, not only to prevent more severe conditions in yourself, but to prevent you from infecting those around you.
Yeah, that was something I learned having gone 50 years without getting a flu shot. And the moment my wife was, found out she was pregnant with our firstborn, she said, "You're getting a flu shot." And I went and I got it. But I asked, like, why? I've never gotten one before. I'm fine. I'm healthy. You know, I joked about my parents being in their 80s and getting them all the time. And she specifically said, no, the flu could be very dangerous to the newborns, especially. And they can't get, you can't get a vaccine until what, you're 6 months?
6 months, yeah.
So, so for folks who thinking, all right, well, I don't need it for myself, it's just as important to think about it for the other loved ones in your life, right?
That's right. You know, it's important to think about it for yourself to prevent more severe symptoms, but particularly important to prevent infecting those around you, especially those vulnerable populations.
Okay, so you've mentioned that you probably should have already gotten the flu vaccine.
Well, there's still time.
Okay.
You know, again, we do recommend September, October, prior to really the start of the flu season, but it's never too late. So I recommend that folks get it as early as they can. But if you find that we're getting into the flu season and you still haven't gotten your shot, it's never too late.
Yeah. So say, you know, you're going to start gathering with people for Thanksgiving, the holidays, etc. You can still get it then, and it'll be effective.
I absolutely recommend that people get it, preferably earlier in the season. But if you don't, again, it's never too late.
So how does the flu vaccine work?
So the flu vaccine gives you immunity from infection. And for the majority of people, it will prevent infection. For those cases where it doesn't necessarily prevent you from getting infected, it still reduces your symptoms and will give you milder symptoms.
What's the number one reason you find that people are hesitant to get the flu shot?
Yeah, I think there's a lot of misperception that getting the flu shot will actually give you the flu, which is not the case. Most people experience no symptoms from getting the flu shot. The most common symptom is simply redness and soreness at the site of the injection. And that is very transient. That will go away fairly quickly. There are some cases of individuals who do get mild fever or muscle aches or headache from the flu shot. But again, those are very mild symptoms, much milder than if you were to actually get infected with the virus. And when you do have symptoms from the flu shot, those go away very quickly.
They're not actually injecting the flu in you. That's one of the common things I hear all the time. The flu shot has the flu. Of course I'm going to get sick if I get it.
No, absolutely not. It's an inactive vaccine, so you would not get sick from the actual virus.
Right. Do you find that another hesitancy in getting it is that some people just don't like shots? And if you've seen me trying to take my now 6-year-old the last 2 or 3 years to the poor technicians at CVS, he just doesn't want to do it. Luckily, he's small enough that I can force him. There's going to come a time, though, where that's not going to be possible. Is there another option?
There is. There's a nasal spray that's available. This is available to individuals from 2 to 49 years of age. And pregnant women, though, are not eligible for that. But I would encourage anybody who absolutely cannot tolerate the shot to speak to their primary care provider if you're between the ages of 2 and 49 about the nasal spray.
All right. Where would I go to get the shot? Would I have to go to my primary care physician, or is it just as easy and effective to go to one of these clinics that are set up? I know the city of Lowell does a really good job of setting up some flu clinics.
Yeah, many cities offer flu clinics. Your primary care provider likely has the flu shot. Many pharmacies do. If you're not certain where to go, you can also check on Vaccine Finder at vaccines.gov. But there are many, many places that offer the flu shot in your community. And
it doesn't matter whether I choose the primary care or get someone from vaccine.gov. I'm going to get the same shot, and they're not going to, my arm won't be safer from the pain if I go to someone who knows how to administer the shot. Or no.
These individuals administering the shot are all very seasoned, very experienced. I would just find a place that is convenient for you.
All right. Dr. Carolyn Langer, thank you so much for joining us for this Health Minute with Dr. Langer, brought to you by UniCare. Very excited. Felt like I learned a lot today, but very excited for what I'm going to get to learn going forward doing these features.
Thank you. I look forward to joining you.
All right. Appreciate it. And thank all of you for joining us as well here on another Inside Lowell podcast, Health Minute with Dr. Langer. You check for it on all of our various podcast outlets. Till next time, everybody, stay safe, stay healthy, and stay well.
All right. I felt good.